So with that, we'll move to the next speaker, which is Rhea. Ms. Rhea Tariq is the Director of Global Impact at HelpAge International. Additionally, she serves as a trustee of the boards of ELRA and the DePaul International, and is a member of the START Network Membership Committee. With more than 20 years of strategic and operational management experience in humanitarian and development programs across Asia, Africa, Europe, and the Middle East, she brings extensive expertise at country, regional, and international levels. Ms. Rhea Tariq's thematic areas of expertise includes health and protection programming with a special focus on aging and disability inclusion in humanitarian policy and practice. Today, Ms. Rhea Tariq will discuss why older people are systematically overlooked in humanitarian crises. Thank you for being here.
Thank you. Thank you, and good morning to all of you. My name is Rhea Tariq. It's a pleasure to be here, to be part of this important conversation on a day of older people. And there couldn't have been a better day to talk about this conversation. I'm really energized by the interest you already shown on the Mentimeter, reflecting why we need to have this conversation today. I work for HelpAge International. It's unfortunately the only global alliance of organizations that have come together to work for the rights of older people. That doesn't mean that others are not doing, but just let me briefly introduce our global network, which is present in more than 90 countries. We have around 200 organizations part of this global network. And it was founded in late 1980s with a simple aim to understand why is nobody talking about aging. And many decades later, we still haven't moved forward a lot, but the dial has shifted slowly and we are seeing these conversations happening. And I think if I maybe start with just one thing today, it's about everyone in this room is going to be aging, and we completely forget that. We heard from Claudia about all the examples of exclusion. And unfortunately, those rights are not withheld. It's not just about humanitarian crisis. It's about countries like Netherlands, countries in the global north, where we saw in the pandemic, those rights were not upheld. There was a disproportionate impact that happened on older people. So what today I'm going to share about and reflect more on is, why is this exclusion happening? We heard a lot of examples from Claudia and the video that Elberg has put together on various stories of neglect. So I'll be focusing on why this happens, and I'll be drawing upon the collective experience of our global network. And it's not just the evidence and the research, it's the lived realities of older men and women that we work with day in, day out. We live in a world where populations are aging. Currently there is about 1 billion older people, and soon 2050 will arrive and that number is going to double. 1 in 5 people will be over the age of 60. But what's interesting to remember from what the data tells us, where will these older people live? And what research and data tell us, approximately 80% of all the older people will be living in low and middle income contexts that are beset by conflict, climate crisis, poverty. And that's the reality. But while it's interesting that life expectancy is increasing, we are, I think, at the moment, the average life expectancy is around 73 years, and somebody who was born today might be looking towards enjoying another 20 years, which is fantastic, which is a celebration of all the achievements we have made as humankind. But what those 20 years mean, you could really be enjoying life, you could be contributing back to the society, you could be learning a lot of skills. but it all depends on one factor, which is health and access to healthcare. And I know Yuka is going to talk later about this later on, but what I really want you all to think about is, what does it mean to be old when you have comorbidities, when you are living in a crisis setting, when you might be old and have a disability? So I just want to focus on that intersection. And from all our research and work across the 90 countries, especially in humanitarian settings, what we have seen is older people are often trapped because at that intersection, they are overlooked. Their needs are not addressed because nobody even counts them, because, you know, all the humanitarian actors do this wonderful thing. They put all older people into this one bucket of 60 plus years. And it means that the needs of 60 plus are the same as the need of 80 plus. So if we are not counting, we are not addressing those needs. I read this scenario in a WHO report back in, I think, 2008 or 2009. And it really reflects the heightened risk and what will happen if you are in such a situation. And why I'm sharing with you today is, next slide. At the start of the war in Ukraine, I was traveling in the eastern part, Kharkiv, about 20 miles from the border. And if you can see this apartment block, which is half burnt, which is, you know, obviously not livable, and you wouldn't expect that somebody is going to be inside there. So I asked my colleagues, why are we going there? It doesn't look safe. And they said, no, there are many older women there still living because they have been left behind. So we went up, we met an older person, older lady living with her cat. And she said her husband has died, everybody left, nobody asked about her. Another person sharing the same kind of story, that they didn't want to leave and they pushed their family members to leave for the West. So they stayed on and they don't have anybody asking about them. Another person saying, well, you know, look at all the food stocks I have. What will I do with all this food? I cannot even walk. Nobody's thinking about my mobility issues. So that was the reality. And, you know, going back to that scenario from WHO report, it really came to life. And these stories of neglect, of being forgotten, they are everywhere in every humanitarian setting. I have been working with HelpAge since 2002, and I see a repeat of these stories. Repeat after repeat, another heartbreaking story from Turkey, where there might be services available, but if you can't walk, what's the point? I remember another study we did back in Sudan, where healthcare facilities were available for older people, you know, medication for chronic conditions was there. But nobody thought about how will older people access until there was a decision made, oh, we need to have some sort of transportation, a donkey cart, ambulance system was established. But because if you don't think about those things, this is not going to change. The recent earthquake in Myanmar, and I'm sure you've heard about the Philippines earthquake today, the situation is going to be the same. Access and accessibility are the main two fundamental gaps that we have. We have stories from all humanitarian settings, whether it's Afghanistan, Rohingya camps, telling us the same, that nobody consulted older people, nobody asked about the needs, and because nobody knew what the needs were, they were not part of the planning. The responses were there. You know, there's a lot of money that public gives when a humanitarian crisis is there, and governments spend billions of pounds and euros and all the money on supporting. But if I say to you, if you all are over the age of 60, your needs don't count, we will be just focusing on the younger ones. That's exactly what happens in every humanitarian response. This is again an assessment we did with the Syrian refugees in Lebanon. And again, people are running for their life. They might be taking some medication with them. They come into this new country, new place, thinking they'll rebuild their lives, but they don't have enough medication and all the healthcare support that's available. It's not including chronic conditions. It's not thinking about mobility aids. It's not even thinking about glasses. For those of you, if I take your glasses off, you'll feel, what does it mean to be vulnerable suddenly? And that too, when there's a big crisis happening. So lots of research we have done over the decades, same findings year on, I think things have started to shift, as I said in the beginning, but not enough. So I think we need to challenge the system. And when we look at the bigger picture, so if you look at where the money is flowing, look at the humanitarian financing architecture. Again, year on year, since 2010, we have been doing this research to look at how much of a consideration are older people in this financing architecture. And as a proxy, we look at 17 to 18,000 projects that are funded through the UNOCHA system. And it's again very shocking that less than 1.1% of project titles mentioned, and you dig deeper, there are less than 6% of projects actually mentioning older people. So forget about actually having the age-friendly, age-inclusive response being funded. I know this is a proxy, it comes with its caveats, but it's the tip of the iceberg. It tells you a lot what's happening at the big picture level. And I think, Amrish, you were talking about the humanitarian needs overview that the UN system has every time. And we have been looking at all the HNOs and the response plans at country level, at global level. Again, there is no recognition of older people, the diversity of their needs, the contributions that they can make. So it's the same that we see every time. And I know I'm not going to talk about this because I think Claudia talked extensively about all the risks that older people face. And you all know, and some of you also shared these in your responses to the feedback this morning. But because nobody is thinking about older people in numbers and planning, all those things are overlooked and not taken into consideration. And what you have in front of you is systemic exclusion happening at all levels. And not all older people are the same. It really makes it more challenging when you're an older woman. You're an older woman with a disability. You're an older woman from an ethnic minority. And we see lots of stories of neglect, violence, and abuse happening, even in humanitarian settings. And I think we all know about these different barriers, but I kind of keep going back to when I started my Help Aid journey. And I used to challenge different organizations, asking them, why are you not thinking about older people? And at that time, I used to get arguments like, there's no economic sense in investing in older people because they have very little years left. So the right thing to do is to focus on children and women because they'll have more quality years left for them. Nobody says that now. The conversation has changed, but unfortunately, the system was designed to prioritize children and women. That's why the needs assessment, the response plans, all the research that we have, you have older people invisible from policy frameworks, from response planning, all of those things. And I think it all starts in the mind and attitudes. Because if we believe that, for example, some organizations would say, oh, well, we think we are covering everything. Older people don't have specific needs, for example. Others would say, well, we don't really know what to do because they're a burden. So that ageism that's pervading the system is there. So if you don't have your beliefs and attitudes ready and open to respond to older people's needs, things will never change. And again, another aspect is accessibility. Like I said, our research has consistently demonstrated it's either lack of access or lack of accessibility. And accessibility to healthcare services, but equally not thinking about the accessible devices that are required to make your life functional. I know Maria is going to talk about that later, and we'll hear more about that. But I think if we got our attitudes right and we got our political will right and we recognize, we will start to change the systems. We will start to think about the communication needs of older people, because life does slow down when you age and you need to have an age-appropriate healthcare system. And sometimes, and again, from some of the research we've done in Japan after the tsunami and the earthquake, sometimes older people, because of the cultural nuances or cultural attitudes, will not share about their needs. So they'd rather prioritize the children, and they'll not tell you about the medical needs they have. Unless you seek out proactively and understand what are their medical needs, what are the emergencies. So if we don't do it as organizations, it's not going to come to the fore. And like I said, many organizations have been telling us for a long time that we don't know how to do it, what to do it, where are the gaps. So after a lot of advocacy and consultation and research, HelpAge, in collaboration with other actors, did come up with humanitarian inclusion standards. It does tell you how and what and why. But more importantly, it also dispels the myth that there are no gaps. So I challenge all organizations to take a look on these standards and see how much of it are we actually doing. And we have been revising these standards. They're a companion to the Sphere standard. And I think we have been accompanying organizations all along who wanted to really shift the dial on inclusion of older people, MSF being one of them. We started in 2012. MSF was very brave and said, let's have a look at our policies and let's have a look at some of the humanitarian responses around the world. But not everybody is brave and willing to look. So we work with WFP, we work with UNHCR and other organizations. We're still accompanying organizations to say, hey, have a look at what you're doing. Take stock of where are you missing the mark, what you need to do. And there are lots of stories that have come. We've embedded age inclusion specialists in organizations. And I'll tell you a simple example. In Ethiopia, we embedded an age inclusion specialist on the protection cluster, and they were able to revise the data collection tool. And after the revision, there was a 6-fold increase in the number of older people compared to what was reported previously. So it kind of goes back to the thing that if you're not counting, you are not really thinking about older people. And lastly, I think one thing I want to say is this always gets forgotten because older people are always portrayed as they need this, they need that, they are passive, there's a huge dependency, but nobody thinks about older people as a key resource. 2 weeks ago, I was in the western part of Ukraine, and all the big players are exiting because there's no more funding in our sector. The government doesn't have the money. So obviously they have to prioritize spending on the military budget. And you can see a huge, it's very interesting. Ukraine has about 25% population as over 60, and this was before the crisis. After the war started, younger people have started leaving the country. We saw even 2 weeks ago, loads of young people crossing the border. There's a decrease in birth rate. Life expectancy is decreasing because the facilities that they were before, they're no longer there. So it's a very interesting demographic shift that's happening in Ukraine. And when the war started, I remember seeing huge populations of older people in the East because they couldn't shift. But in the West now, after all these years, all I could see was older people and veterans with disability. And they are very much aware that there's a funding crisis. There is no more money for all the healthcare, social care, other things that were happening. So what was really inspiring to see was some of the older people have taken it upon themselves to say, you know what, people can leave us, the world can forget about us, but we are going to be there for each other. So we have older people who are mobile and can move around, providing buddying up, providing psychosocial and mental health support to older people who are homebound and cannot move. So I saw this resilience, this leading from the older people themselves. And this is often not tapped because we look at it from an ageist perspective. Oh, old, they cannot do anything. So I saw this inspiring example. And I think it really makes me wonder if we were all agreed here and we are giving up a day of our lives to have this conversation. So whatever you do, whether you're part of academia, research, INGOs, NGOs, if you could put your hand on your heart and say that whatever we do, are older people really visible? Are they recognized in our work? Are they actually participating? Are we actually seeking out their participation? Or are we just planning research and programs and policies without consulting them? Are we removing all the barriers? Are we upholding their rights? Are we using that data that we use to plan our things? Is it disaggregated by age, disability? And, you know, we've got NSF colleagues here. I mean, a question to you maybe, that you have a huge medical footprint. Is your healthcare, are your healthcare services age-friendly? Are the workforce that are delivering that, are they skilled? Do they understand what it means to deliver healthcare to the older people? So I'll leave you with that thought and maybe a question. What will you do as a result of today when you go back to your busy lives? Because I think inclusion is everyone's responsibility. We will also age. And, you know, whatever we do starts today. Thank you. Happy to for any questions.
Yes, are there any questions for Rhea? Anyone online, maybe? Not at the moment. Okay. Well, you can find Rhea in the coffee break. Ah, Oscar, go ahead. Wait, sorry, I think you have to speak in this because otherwise
Very much for the inspiring talk. I'm just wondering whether you could tell us a little bit more about your experience in Ukraine 2 weeks ago. How much has it shifted since the beginning of the conflict, and what is the situation now? And I'm aware of many refugees that came to the Netherlands and they came without their grandparents. They left them behind.
Thanks for that important question. I think, as I said, people who can leave and who are mobile have obviously they are leaving the country. But it's important to understand that older people are very much attached to their country and to their houses and to homes. So what you see behind is a big population of older people. And the gaps, I think, ever since the start of the war have only increased in terms of what the needs are and what the capacity is. And with the funding crisis happening, whatever complementary services INGOs and civil society was able to provide, that's also at a huge risk. And the worrying part is also this humanitarian reset, which is happening right now. And what I understand is all the areas of responsibility will be clubbed into one group, which would be a threat to inclusion generally. Because we have been working in Ukraine, for example, we did set up an age and disability task force that was working with the broader sector. But if that's wrapped up, then the influence kind of goes away. But the resources of the local organizations and the resources of the communities themselves are something to be tapped on, because they are very clear that, you know, we want to fight and we want to mobilize awareness about with the world that's starting to forget us. So there is that fatigue happening, but there is a growing momentum where you can see, you know, communities demanding that, yes, there is a war happening, we need to prioritize, but how are we going to work out a solution? So the gaps are widening, definitely.
Just to a final comment, we are in academia. I'm in academia, and quite often we are felt like we're sitting or we are hanging in this ivory tower. We want to also support the efforts that you're doing. If there is anything that we can do, anything at all, please let us know. We'll be happy to contribute.
Sure. Thank you. Thank you.
Thank you, Rhea.
Thanks.
Thank you.